Let's talk about electrolytes and PVCs. A PVC is also known as a premature ventricular contraction, and it looks kind of like this bad boy right here. You see the patient has a normal ECG, and then boom, kind of just comes out of nowhere. A PVC is an extra heartbeat that begins in the lower chambers of the heart, also known as the ventricles. The majority of us have PVCs at some point in our life. We may feel a little fluttering in our chest. Sometimes it can just be one PVC. Oh, look, I must be a little red. Anyways, you may just have one, you may have a group of them, you may have sustained PVCs, also known as ventricular tachycardia, but nonetheless, PVCs are relatively common, but there's a lot of different causes for them. These are some of the common risk factors for PVCs: advanced age, male gender, hypertension, African American, hypomagnesemia, I can't say that word, bundle branch block, hypokalemia, and underlying ischemic heart disease. Also, excessive calcium can cause them as well. For this video, I'm going to focus mostly on the electrolyte abnormalities and how they influence PVCs. On the molecular level, there are a few changes that create an environment for spontaneous depolarization of the ventricular myocytes, aka having a PVC, and these include hypokalemia, hypomagnesemia, excess calcium, and excess catecholamines, which we kind of already talked about. Okay, but how do electrolytes play a role in PVCs? Well, potassium, for example, plays a key role in regulating the cell membrane excitability. So because potassium helps maintain cell membrane excitability, a low serum potassium level can increase the transmembrane electrochemical gradient, thus hyperpolarizing the cells and impairing depolarization and contraction. This can lead to a disturbance in the cardiac conduction pathway, aka you can have a PVC from the ventricle firing prematurely, causing the premature ventricular contraction. So as nurses, what can we do about this? First of all, we need to know, is this an isolated occurrence or is this something that keeps frequently happening? If I see a random PVC on my patient and never occurs again in my 12-hour shift, I'm probably not super concerned. But if my patient hasn't had any PVCs for hours and suddenly they're having a bunch of PVCs, I need to look into why is this happening? My first go-to is always to check the patient's labs to make sure their electrolytes are either normal or they were replaced appropriately per your electrolyte protocols. And I'll also take a look into the patient's medications to see if they have any medications that have affected their electrolytes, such as diuretics, Lasix, etc. Also, if my patient's having multiple PVCs, I will for sure notify the provider and let them know. That way they can decide if they want any further testing, labs, etc. And there you go. That's my 2 cents on PVCs and electrolytes.